Hi guys. I don't actually know now that I think about it in Ontario or if it's all of Canada. January 27th is what's kind of known as Bell Let's Talk Day. Bell is a communication company and they sponsor, basically it's an awareness campaign for mental health issues on January 27th. I think I heard on the radio this morning that it was like 12 years that it's been going on or something like that. Anyway, it's, plastered all over my Facebook and all over Twitter today. It's trending in Canada, trending in Ontario, all this kind of stuff. And I usually do a blog post about it as well, just in relation to mental health awareness. But this year I thought I would actually do a vlog about it. So I have actually brought up my children to, I don't know how much of it is understand, but to at least be aware of mental health. There's, various personal reasons for it, but a big one also being, what I'm studying for a living, social work. It's what I'm choosing to do for a living. So, I don't know how much my son understands about mental health issues because it is quite an abstract concept. So having a child with autism, I'm not sure what he understands. But my daughter, I am very, very proud of her that she does understand as best as she can, age appropriate, about mental health and looking after her mental health and understanding, there are certain things that I need to do, like chai, for my own mental health. I have friends that have been diagnosed with some quite serious mental health issues. Some are managed fairly well, some are not. They're still looking for management opportunities. And one of my dear friends, actually, he doesn't respond to medication in any way. The only way for him to try to manage his mental health actually is through shock therapy, which is very different nowadays than it was way back when it first started. But, at least he's figured out that that's something that works for his bipolar diagnosis, for example. I have lost a few friends to depression, and their depression basically, I don't like to say that their depression is what caused them to commit suicide, but that's what I'm going to go with right now. My own personal journey with mental health issues is close to the end of my marriage. I had what's called situational depression. And then again at the 1-year anniversary for the end of my marriage. It was not a happy end to a marriage. Not that any of them are, but I needed medication to be able to function, to be able to still be a mom, to be able to kind of still do everything that I needed to do because I was the sole parent at the end of my marriage. So I'd love to go into more details, but now that my daughter has started her own channel on YouTube, she may or may not listen to this, and that's information that she doesn't need to know quite yet. But I meet a lot of parents of kids with special needs, and I don't know who they are, but they who have 10 million degrees and lots more brains than I do have determined that parents of kids with autism especially have the same kind of stress levels as soldiers coming back from combat. Whether or not that's even comparable, I have no idea, but I know and I experience the stress level that I experience. And in the last let's see, 6 years, I've needed just a little bit of medical, chemical help 3 times to be able to kind of manage my own internal thoughts and keep my brain being my best friend instead of being my worst enemy. Just because of situational depression. I haven't had to be on medication for very long each time, but I have a fantastic doctor. He is very much part of our team, in that he he knows, I should say, he knows that I have enough medical knowledge, even though I don't have a degree of any kind in medical anything, that if I'm coming in saying, I think it's time, my brain is not my best friend right now, then he knows, and he goes through the assessment with me, and we determine what to do, and 6 months later I go off and everything's fine. But it's nothing to be embarrassed about. When I see somebody or I am talking to somebody that to me shows all the flags of either depression or anxiety or anything like that I'm aware of, I ask them to contact their doctor and to talk to them about it, or to seek out a counselor, or to go to yoga, or any of these types of techniques that will work. And I love the fact that so much of my Facebook news feed right now is covered in Bell Let's Talk, and all of the different videos that different famous people are putting out in their journey about mental health issues. Howie Mandel with his OCD, and there's a female Olympian, I can't think of her name right now, I'm sorry, but her constant battle with depression. And I mean, this is a woman who has won Olympic medals in both summer and winter Olympics. Like, you would never think that she is trying to manage depression. So the point of Bell Let's Talk Day is to end the stigma. And at least in my world, I hope that there isn't any stigma. I don't see stigma in my world. But I also, have chosen a career and an education path where if there is any stigma for mental health, then they're probably in the wrong profession or the wrong study. But I encourage you, if, specifically in regards to depression or anxiety, if your brain is overworking all the time and it is not being your best friend, you're sitting there in a room full of your friends and you feel like you're alone, or that, you just can't stop the worry, or that you're experiencing a situation right now where you should be happy, but all that you can think of is the what ifs and the well, they can't possibly be doing something nice for me. What's the string that's attached? What's this? What's that? When your brain is not being your best friend, then, it may just be time to go and touch in with a counselor, and that's fine. If it's more ongoing and it lasts for months and months and months, or even years on end. I have a friend who, she unfortunately does not have a good working relationship with her doctor, and she has needed anxiety and depression meds for as long as I've known her, and I've known her for about 4 or 5 years now, and her doctor just won't give it to her, plain and simple. And she needs it, and she knows she needs it, and she wants it, but her doctor just won't do it. To me, then, it's find a new doctor, but that's just me. So I encourage you to, whether or not you feel that you are needing a little bit of mental health touch-up, or if a friend of yours comes to you saying, this is how I'm feeling, what do I do? Support them. You know, be the ear to listen to them. Don't try to fix it because sometimes the fix may not be something that you can do. You know, it may be that they need a counselor. They may need a weekend off to go and rest and rejuvenate. It may be that they actually need chemical interventions. You know, if I heard one of the things said on the radio this morning, you know, like diabetes, for example, is back in the day, apparently you had to like take your insulin shots in secret, which I don't understand that. Whereas nowadays, you know, people just know about it and understand, and it would be great to get to that point someday where an invisible disability or an invisible issue such as mental health is no longer something that people need to hide. You know, as I mentioned, I've taken medications 3 times in the last almost 7 years now, just to be able to get through, and, you know, nothing wrong with that. I know when I'm getting to the stage and when my brain is getting to the stage where I need that extra help to be able to manage everything and juggle all the balls and get out of bed in the morning. And it's not just because I'm tired. That's a whole other issue. But the great thing about Bell Let's Talk Day is that it is getting people to talk. I will link below some of the stories of the spokespeople for Bell Let's Talk Day, with their stories related to mental health and mental illness issues. I mean, the big one is Howie Mandel and his OCD. Like, it's well known now that he has OCD, but back in the day he would hide it, and you know, he couldn't either. So anyway, I feel like I'm rambling for this, but if you feel like you're being overwhelmed, I encourage you to talk to your doctor, talk to a counselor, just talk to somebody, you know, do some research, see if there's a valid assessment online. As I said, I know enough of my own self and also with what I'm studying that I know when it's time for me to contact my doctor, or if it's just time for me to call my counselor and say, you know what, I need to come in and chat. And there's nothing wrong with that at all. If you have any questions about depression, feel free to leave them in the comments below. I'm happy to answer if I can, or if I can help direct you somewhere online, or maybe a local resource for mental health issues. And just keep talking about it. You know, there's nothing to hide with mental health issues. It just, you know, you don't have to hide that you have cancer. It's an illness as well. Mental health is so, so important. And, you know, my daughter and I talk about mental health often. I mean, we're a divorced family. She has a twin brother with autism. Things are difficult sometimes. And I've always been very, very proactive in trying to help her, especially make sure that her mental health is strong and that she's able to articulate what's going on. And some of the stuff that she has done in the last 6 months has shown that, you know, she is way further along in that knowledge and understanding than I have been. You know, my knowledge has just been in the last 10 years. Hers has been her entire life now already. So, and she's articulating what she wants, and you know, I've got her back. I'm getting as much as I can for her, as much help, and standing behind her for everything that she is articulating, which is awesome. She does not have any mental health issues, but if she sees stuff on the news, for example, which we don't actually watch the news very much, but she'll be like, you know, why did somebody do that? And my response is usually because their mental health is broken, you know, and it's as simple as that. You know, she doesn't need to know every single piece of information because that's not child appropriate. You know, most people can't understand OCD or PTSD or schizophrenia with hallucinations or psychosis or anything like that. Like, those are dramatic mental health. So I just work with, you know, just helping her with the everyday. And obviously my son is there listening as well. I hope that he's taking it in. I just don't know how much he's taking in. So on January 27th every year, it is Bell Let's Talk Day, and that's all about raising awareness about mental health issues. So if you need to reach out to me, I welcome you to do so, whether it's in the comments below or send me a message through YouTube. I will answer as many as I can. We'll talk to you guys later, and happy mental health. Bye, guys.